minutes. After that, you.
Okay, sir.
You welcome from then Surendra Garu after that.
Yeah. So, good evening, everybody. We are welcoming all for today's evening's program. Let us go ahead. Surendra sir, please take the group forward. Thank you, sir.
Shall I take over?
Yes, sir. Yes, sir. Please.
Yes. Good afternoon, every elite member. Sorry, I could not meet you in the last week. And as most of us busy, lecturers are busy.
Surendra Garu, many happy returns of the day. Happy birthday.
Happy birthday, Surendra sir. Happy birthday.
Happy birthday.
Last Sunday,
Sir.
I reached the 80.
Happy birthday, Surendra.
Happy birthday.
Happy birthday.
That's why I could not meet you.
Yeah.
That's why. Formal celebrations. And
Okay.
Very nice.
Yeah.
I'll send my photographs
Okay.
afterwards.
Okay,
So
sir.
Thank you.
You'll feel happy.
Okay.
See, it's very difficult to reach up to 60, 70 and 80. In these 10 years, man struggles himself. And the medicines also make lot of struggles. Though you are taking medicine for stomachache, you get some other problem. Various reasons. The genius Hahnemann visionary Hahnemann has programmed all these things there 200 years back, 150 years back. I tell you, more you dwell into the subject, you know the depth. Otherwise, ex facie, it's just like taking some medicine, taking pulse. All right, what is it? Headache. When it is coming, all right, take belladonna in the summer, take arnica in winter. Like that, we have been going on. But Hahnemann visioned it. Why he is getting frequent? What is his basic defects? So all these things have been enshrined by him, analyzed by him. But only a few of his followers were able to grasp. That is, for example, I tell you, there's a great saint. He teaches Gita to all of us. Only a few can grasp the fundamentals. Others will think, yes, you must be pure, you should not do anything, you should not harm anybody. That is not Gita. What Gita says, what is your purpose of birth? What are you placed in? What you should proceed? Similarly, the Hahnemann followers have, only a few have able to know his roots, and developed it by virtue of their experience and people's contact, patients' contact, etc. Sir, why you are making much out about? Yes, being intellects, we can easily understand than a common man. If you express something, you can understand both 2 or 3 meanings in that. You must choose the right one. A person who doesn't understand properly takes the wrong direction. That's what the philosophy says. That's what the prescription says. So, it all depends upon the way in which you have understood the concept of homeopathy and its philosophy. All right. am telling is, even though during his days says, see, in fact, I wanted to take, I don't want to take cancer subjects in because I bored you much on cancer subject. But you see, today when you see any paper, any article, you get nothing but cancer, about cancer, about cancer. See, in Hindu, 30th January, a very big article on evolution of cancer. The genomic revolution promises to transform cancer care. That is, we are forced to understand the genomic condition, the gene conditions, and then go to the ultimatum, you trace cancer. 5 weeks back, I told you in the lectures that every basic, either it is chronic or acute, epidemic, endemic, whatever way you are affected, why you have been affected. You are a recipient of that problem. How you are affected. The family members of yours have not been affected. That is where the study comes in. We go deep into that. We go deep into that. Whenever an article on medicine is there, read it. Not that you want to master it and apply it. You must understand this because you are now up to the different levels, either engineering or doctor or the lawyer, as the case may be. You have reached the top. Now your mind is wide open. At this age, you have got many gaps in your brain to understand, grasp things. You can easily understand because that's a space for you to put all these things into that. That's why I'm telling you, being a senior citizen, you must know your health because you see, there's a millionaire, 45 years, 50 years, they die. A beggar, 80 years, he lives. What's the concept there? Maintaining health, understanding the problems. That's why I'm again and again emphasizing for us. And there is, you all know, in WhatsApp, you get what the senior citizen should do's and don'ts, this and that. When American WhatsApp has come, it says there are many medicines that's helping you. You have a good exercise, you had a good appetite, you good sleep. So these are all the things. Medicine cannot help. What they say is true. They come to them. That is what our ancient philosophy is. Ancient philosophy. Man to be healthy must have healthy habits. He should not have a guilty mind, irritable mind. If somebody says something, you should not take it in a negative form. That affects you, not that man. You take it, grasp it, take good out of things. That's what our philosophy says. Whoever preaches something, take good thing out of it. Either it's a child or a boy or an elderly man, as the case may be. Take good thing out of it. Use it, keep it, follow it if you want to. this is health, keeping the mind healthy, etc. All right, all right. I'll go to deep into the subject. Another.
Today is World Cancer Day, sir.
Sir?
Today somebody has sent me World Cancer Day today.
Yes, yes,
Somebody
yes.
has sent me.
Yes, sir. World Cancer Day today. Today World Cancer
Sir,
Day.
rightly pointed out.
Yes.
You have started with cancer, so today World Cancer Day.
Yes. Hanuman says acute and chronic diseases are characteristic symptoms of latent sora. That is, without sora, you will not get these acute or chronic problems. That is, the basic is sora. When I said sora, you go back to all the lectures I have given. Either it is through generations passed on to you, or you have acquired it, or your wrong administration of medicines have troubled you, as the case may be. Yes. The gradual transmission and incredible development of ancient contagion for 100 generations. Contagion means passing on to generations. For 100 years, generations, not even 100 years, etc. It is called, Hanuman has been using in his lectures the constitution. The then followers are very much perplexed why he is using the expression constitution. Constitution means not our legal term, it is bodily term. Bodily term. You are made up of your body. Head, mind, eyes, ears, nose, digestion, legs, limbs, activities, understanding, digestion, sleep, etc. This is your constitution. This constitution is not same as that of your friends. This constitution of yours is not same as that of your friend. It differs. How? Through generations, through dry generations, as I already said, through acquired problems, etc., etc. What happens? Neglect, distortion, over refinement, physical and moral abuses in the professional or private life, human passion, various morals, customs and habits. So these are all the basic ingredients that make the habitat of a person change his problems or understanding or body constitution time and again, now and again. Yes, what happens due to that? He says in his aphorism 5, reflects mind, body, complex of human being. What do they do for us? How do they live? What is their sexual behavior? How is their intellect? All these constitutional factors must be accounted for when giving a prescription by a homeopathic physician. That is where comes in. What are all these things lead to? Prescription. What is altered disease? Body, soul, constitution, etc., etc. of the disease, signs reflecting sufferings in the body. You should have a constitution as a part of grand total triggerment of human predisposes certain chronic miasms. Have you ever seen a child getting sick? Let me say that common child diseases. The child will always exhibit mental, emotional charges. That is, irritability, clinginess, withdrawal, etc. That is general behavior. When she is placed on the floor, she will be only doing all these sorts. Assuming that she is diseased, pain, fever, rash, swollen limbs, etc., certainly the child will not be calm. The diseases moves into the interior to the exterior and for more important organs to less than important organs when cure occurs. The concept is this. A healthy child, everything is normal. A infected or affected or diseased child, body changes takes place. Fever, irritability, restlessness, cries, could not sleep. So consolation doesn't help. Some medicine is given. In the meantime, whatever you medicine give, it goes. Here, mere giving of medicines means accurately choosing the medicine. What is there inside the body? The disease that is spreading towards from the main parts to internal organs or up to the internal places, skin, nerves, etc., etc. The correct chosen medicine, when applied, soothes and transforms the disease force into a healthy condition. Slowly, your well-selected remedy goes into the body and tries to remove the morbidity, expel the morbidity, and health is restored. Vital force gets rejuvenated. Again, child becomes happy and claps its hand and calls us and smiles at us. This is all the thing. For this drama, a physician has to struggle himself, understand himself. What is the basic things that one physician should know? What is the experiences the patients have done, undergone? All these things are revealed by our experience, by our understanding with the other physicians. So this is one thing as over. Then, what is the difference between symptomatic system of in the allopathy and symptomatic homeopathic treatment? Here is a symptomic, there is also symptom. What's the difference between these two? Allopathic physicians often will say to the homeopaths, you are only treating based on the symptoms. But there is a very distinct difference between allopathic system in the treatment according to the common symptoms of the disease. They name the disease, give the medicine. For example, liver problem. So, cirrhosis of the liver. they give medicines. How the liver problem has come? What is the basic problem there? Mere giving a well proven allopathic drug to the cirrhosis of the liver may cure, but will not be last long. You have not eliminated the causing factor for the liver disorder. Whereas in homeopathy, we go by symptomatic treatment. What are the symptomatic treatment? Peculiar symptoms, common symptoms, acute kidney problems. Even here, when his history is revealed, we know that it is a psoriatic psychosis where he is having a cancerous base, where he is undergoing septic base, etc., etc. That is where we go to the root of the matter. Then you don't have medicine to name this disease or condition. No, not necessary. Because homeopathic medicines, when chosen and when prescribed, it goes to the root of the matter. It goes to the root of the matter. No doubt in that. No doubt in that. Rheumatism, painful menses, eruptions, palpitation, and problems in the feet. Most allopathic doctors proceed in the fashion and they send them to the different experts. Eye disease, go to the ophthalmologist. Heart disease, go to the cardiac specialist. Liver disease, go to the gastroenterologist. Skin disease, go to the skin specialist. They go there, they analyze only with respect to the skin problem or analyze with respect to the eye problem. Whereas a homeopath is the only treatment where you go into the entire aspects of the human body, the constitution of the individual person. That is why the well-chosen remedies go deep into that. Slowly it will remove the present problems, followed by further prescriptions will remove you from all the future complications. You become hale and healthy. This is all the thing. Of course, I'll go deep into the subject in the next class, provided you are very appreciable or accepting. Okay, thank you very much. Thank you. Yes, over to Anup sir.
Yeah, thank you, sir. Both sir, you can take on, sir.
Is my voice audible?
Yes, sir.
Namaste, my dear homeopaths. Thank you very much, Surendra Garu. You have touched on what symptomology we have to observe. What a prescriber or a homeotherapist must know before handling a case. Thank you very much. Only two things you have to remember. All our elite members I am telling. One is objective symptoms. By seeing the patient, you will know certain symptoms. That you have to note down. And you have to ask certain questions. That questions they will reply. That is a subjective. Sometimes along with the patient, somebody will come, either their relative or friend, whatever me. You have to ask them. If it is a fresh case, means you have to ask them also what are the symptoms they observed. So sometimes patients will tell everything is okay. Like this it will happen. So we have to know what is objective. That is what we observe. That is objective symptoms. Then we have to ask the questions or what the patient is telling, that we have to narrate, and we have to convert that symptoms into our language, homeopathic language symptoms. Then you have to bring back the proper medicine. See, in this, though today my class I will take afterwards, one example I want to give you. Last 2 to 3 months back, one lady has come. She is 32, 31 years old, not married. She's a what we called computers, software. For 3 months or 4 months back, in her office, total electricity failed or something happened. So much of shock, electric shocks are there. Several people have got the shock, and immediately some doctor has come and they have given, some people they have given the injection, some people they have given the pills or like that. Something happened. 2 days they have given these who are the sufferers, they have given leave also. This lady, after that, after 1 week of that shock, she has to get her periods as per that her dates. She couldn't get it. And after this shock, she got pain, stomach pain, continuous 2 days. She has taken rest in the house also. This afterwards only she told. So she went to all checkups because computer field, software field. So all tests they have gone, nearly 35,000 to 40,000 company has paid. That is, everything is okay. But periods has not come last 3 to 4 months. So she has gone to a renowned homeopath in city and paid nearly 6,500 rupees. He has given some medicines, it has not worked. Like that she has gone Ayurveda and Siddha something. Afterwards, 3 months or 2 months back, she came to me. I have observed, it is not the case of a amenorrhea. It is not the suppressed, it is a suppressed menses, that's all. What is that one? I have asked several. No, I am hale and healthy, sir. I will do half an hour or 45 minutes gym. I will do 20 minutes. I will do yoga, and 10 minutes I will do breathing exercises, pranayama and everything like that. She has told nearly 45 minutes about her, and she told from toe to hair, no problem for her, except this one. Last 3 to 4 months she is suffering. She is getting pain, stomach pain at that time. Whenever menses time is coming, as per her record, at that time she is getting pain only. So I have observed nothing, no medicine. I told I don't want to give any medicine, but I want full data means. Then only she told about this shock and everything. That too her mother has told. So with this I have given phosphorus 1 dose of 200. Phosphorus, actually I want to give 1 mg, but I don't want because it's the new patient and she doesn't appreciate our homeopathy also. Mother is my patient. So she came because of the mother's pressure. I have given phosphorus 200, we will see. They are in my colony only. It is a walkable distance of 5 to 10 minutes. I asked that lady, every 2 days you come to my house, 2 to 3 minutes. I want to give single dose. Simply I told. But I have prepared one vial of Arnica 200. Morning 1 dose to evening 1 dose for 3 days. After completing 3 days, you come to my house. She has taken the day when she came at that time, phosphorus 200, 1 dose I have given. The next day onwards for 3 days, Arnica 200 morning, evening I have given. So 4th day she has to come to my house. On that day, in the software company, they have extended their time, so she has left the company at 11 o'clock like that. She telephoned to me and mother has come. Sorry sir, could not come because of this reason. Doesn't matter man, after 3 days let her come. Don't come in between that one, after 3 days straight. 3rd day mother alone came. On that day she told she's menses started her, she is getting abnormal stomach pain. So immediately I have given Magnesia Fast and Simicifuga morning and evening. Every 1 hour you give for twice a day for 2 days. Simicifuga 30, Magnesia Fast 30. After that 4 or 5 days she came to me. I am okay sir, I am excellent. I am weak because it come nearly 6 days with black and violet color menses. After that I have given some acid fast and China 30 morning and evening. For 5 days you take and leave it. She came for any course I have to take. Last week she came. I told not necessary, you are hale and healthy, don't go. If anything comes, please come. First try homeopathy. If the homeopathy not works to you, the concerned doctor will tell 5 days or 7 days or 10 days. After that only you have to go to allopathy doctor, because your company is bearing the amount, you are going and spoiling your system. So she has brought nearly 3 people to me, 3 patients, all are menses problems only. This is the symptomology. See, here no symptom at all, because of her accidental prone. It is because of the shock, electric shock, something happened to her system, that we have released by phosphorus. So she got panic. Any shock and panic comes means you can give rescue remedy, because it happened 4 months back. Rescue remedy may not work, and even Mimulus, I don't have that much of confidence on Mimulus to give her Mimulus Aspen. So directly again phosphorus. Anyhow, that girl will not like homeopathy. Let it be. 3 days she will suffer, she will leave me. Mother is there, the entire family with me only. So phosphorus I have given. 3 days I have given arnica. After that, lady has not come to me because of some reasons. After menses I have completed, she came. I am somewhat weak. That's all. After 10 or 12 days she came. Now she is okay. I am telling, symptoms we have to note, and after that objective symptoms are more important. This here also luck plays a lot, because we will get nearly 7 to 8 drugs to our brain. In that we have to select in proper manner. So amenorrhea only, because last time also amenorrhea I have taken. Again today I am slightly repeat that one. Amenorrhea means absence of monthly menstrual practice or suppression or like that. For that actually we are having pulsatilla is one of the best remedy. When a person is having mentality of telling the symptoms, they will weep or they will feel the pinch of that sorrow. At that time pulsatilla you have to give. Calcarea carb when they are stout and calcarea carb constitution is there, we have to give. Graphitis as per the skin symptoms and as per semi constipation will be there, and any sudden suppressed or catching chill or like that, any shock or any fearful or anxiety, with at that time aconite 1 or 2 doses is sufficient. When there debility of anemia or like that is there, you are having ferrum phos and ferrum met. Like this we are having amenorrhea. So one of the main point in amenorrhea for young girls, young ladies, is called chlorosis. CHLOROSIS. It is a new chapter. CHLOROSIS, chlorosis, otherwise called as green sickness. Green, GREEN, green sickness. It is in between from puberty to the age of roughly 21-22 years, say about 25 years. At that time, the patient is very pale, earthy complexion and anemic condition. Their hemoglobin count is less than 10. These are the general symptoms. By seeing itself we can tell. By seeing the face or a body or anything, by seeing we can tell this lady is anemic condition. After showing the pathology report, we can see the hemoglobin. But that way observation symptom is over. Again we have to ask. So they are all anemic patients, they are not active. They will not participate in any active programs. They are very lethargic. They want to keep always silent and morose personalities. So here severe form of anemia will be there. Symptoms generally patient feels fainting or sinking of strength, extreme prostration, always they will lie down, weakness, debility, lassitude, and heart also weak. Sir, I am weak in the chest and heart, sir. They will tell. Heart weakness is not there. Chest weakness is there. Even breathing, deep breathing also they cannot tolerate. And eyelids also not fully opened. They will not active also. They are somewhat, their neck is this way or that way fallen. And these people generally amenorrhea will be there for 3 to 4 months. And if it is there, only spotting or very scanty will be there. For this, general symptoms are anxiety, fear, poor and improper habits of dieting. Junk food they will eat more. With junk food only they will fill up the stomach. These people will always feel the junk food, preferably chips and lace, something they will sell now. All these things they will eat. The malnutrition or poor nutrition will be there, and chronic ailments of body. All fingers, if you see, all are black, and even nails also seen violet color. There will not be any rose color or red color. For this generally Aletris ferinosa will work. In the beginning also I told, for younger girls only Aletris ferinosa we have to give as a tonic. That also this will work for PCOD also. So Aletris ferinosa very useful in anemic and relaxed condition of the female ladies, that is younger females. Debility, slow digestion, poor appetite, distress, vertigo. Always they will have head reeling, sir. Head reeling nothing but type of vertigo. And habitual tendency of abortion at the immediately after the marriage. After the marriage means at around 22, 23 at that time, not the marriage after 33 or 34. Gossypium. Another medicine name is Gossypium. Gossipium. It is also one of the best remedy for amenorrhea. Menses will come if it is suppressed because of the physical point of view. Physical symptoms are there. And sometimes they will feel nervous chillness, in back chillness will be there. At that time also Gossypium will work. Alumina means constipation, constant constipation will be there, and they will not feel to pass the stools also. Dry up of the body will be there, and debility, lack of vital heat, that is most important for alumina. And the most important another one, our favorite drug is arsenic album. This is also one of the best remedy for chlorosis, and this is one of the best remedy for pernicious anemia. Pernicious and slowly going down. The reading 11 to 10, 10 to 9, 9 to 8, 8 to 7 also. That is pernicious, continuous falling down of the hemoglobin content. So at that time also we have to give. And these people generally they will have leukorrhea. These females will have leukorrhea, that is by discharge. We have to treat that also, because it will convert into prostituria. Proteinuria. Proteins will go away. So by that way we have to concentrate and control that one. By that way we can increase the anemic condition, reduce the anemic condition, increase the health of the patient. So next week I will take certain what we call mother tinctures, which is useful for ladies. So with this my lecture is over, sir. Anup Kumar sir, you can take. After yours, Suresh Kumar will take.
Thank you, sir.
Thank you.
Sir, you have touched amenorrhea in details. And I will be also using the same topic today,
yes,
with little more wider areas and causes of that.
Yes.
And also you have given a lot of medicines. I will be taking some of those same medicines and one or two additionals also. I'll just put my presentation now.
Okay, sir. Okay.
So in menstruation, we have a lot of menstrual disorders, and of that, one where the periods are absent is called amenorrhea. Murthy sir has given us a detailed lecture on amenorrhea. I will be extending that with little more causes and reasons for that. So amenorrhea, just picture for telling you what are the causes. Hypothalamus, pituitary and ovaries, uterus, cervix and vagina. These are the key areas where, or what all organs which will play on the amenorrhea. Okay, amenorrhea is the absence of menstruation in women in the reproductive age. So old people that is old, they will be after menopause, and young girls will be below the age of 11, 12. They are too young for having menstruation. So the amenorrhea is the absence of menstruation in the women of reproductive age. Physiological states of amenorrhea are seen most commonly during pregnancy and lactations. So physiological reasons will be during pregnancy they will not have menstruation, and during lactation, breastfeeding time, the menstruation will not be there normally. So this is a form of contraception known as lactational amenorrheal method. So during lactating and breastfeeding time, their periods will be mostly absent, and they are like they will not get pregnant during that time. Outside of the reproductive years, there is the absence of menses during childhood and after menopause. So these are the times when you don't see menstrual periods. So the causes and classification of amenorrhea. The primary amenorrhea, menstrual cycle never started. So this primary amenorrhea means they have never had the menses at all. May be caused by developmental problems such as congenital absence of uterus. If the baby had been born without a uterus, sometimes it happens. Congenital disorders will be there, and then they will never have menses in the time of that age. So that is one of the cause. Then failure of the ovary to receive or maintain egg cells. So if the egg cells are produced, but it's not being placed or moved into the uterus, that also will be a reason for not showing any menstrual periods. It is defined as the absence. The primary amenorrhea is defined as the absence of secondary sexual characters by the age of 14. Normally, after 12, 13, the girls will start showing secondary sexual characters like development of breast and hair growing in the underarms and the pubic areas. But this will be there will be no symptoms like that with no menarche or no secondary sexual characters. At least by age of 16 they should have had, but that also is not seen. So that will be the symptom of the primary amenorrhea. So primary amenorrhea is the absence of menses by 15 years of age or with normal growth. Secondary sexual characteristics will be there, that is not there. So after 13, they require evaluation to see what is wrong with them. Most cases, it will be genetic or anatomic. There will be something wrong with the anatomy. Pituitary or hypothalamic dysfunction will be the cause. So that will be the subject we will be discussing now. So secondary amenorrhea, menstrual cycle ceasing. That means it will start and then stop after some time. Is often caused by hormonal disturbances from the hypothalamus and pituitary gland from premature or intrauterine scar formation. So this can be premature menopause will be the cause. Pituitary gland or hypothalamus secretions will not be properly secreted. The secretions would not be proper. That can be the cause. Or intrauterine scar. There is some scar inside the uterus can also cause the stoppage of menses. It is defined as the absence of menses for 3 months in a woman with previously normal menstruation. So she was having normal menstruation, and for past 3 months there is no menstruation. Like what Murthy sir told now, the electric shock had caused the stoppage of menstruation for past 3 months. Or 9 months of a woman with a history of oligomenorrhea. Oligomenorrhea means the menstruation that involves infrequent periods, which may regularly go longer than 35 days between the periods. So some people will have, normally it is 28 days, which is calculated one lunar cycle, but it extends to 30 days, but some people will have even extended 30-35 days like that. So that is called oligomenorrhea. So for such people it is taken as 9 months if they are absent, it is taken like that. So the causes and risk factors of amenorrhea. Natural amenorrhea. During normal course of life, women may experience amenorrhea for natural reasons such as pregnancy, breastfeeding, and menopause. When these 3 physiological conditions happen, they will not have menses at all. That is, during pregnancy they will not have. When they are breastfeeding the baby, they will not have. And menopause time also, after menopause they will not have. So next is contraceptives. If the woman who is taking childbirth control pills, chemical pills to control the childbirth, hormonal pills, they may not have periods. Even after stopping the oral contraceptives, it may take some time for them before the regular ovulation and menstruation returns. If the contraceptives are injected or implanted, it may also cause amenorrhea, as some types of intrauterine devices also are there, which are hormone-releasing intrauterine devices are there. If those are implanted also, you may not have the normal periods. Next is medication. Certain medications can cause menstrual periods to stop including some types of antipsychotic medicines, like psychiatric medicines, psychotics. If you take that, then they will have some sort of the periods may not be there. Cancer, like chemotherapy or such things, will not have the periods will be stopped. Antidepressants for against psychiatric treatments, that also can delay or postpone or stop the menses flow. Blood pressure drugs and allergic medications. These all medications can cause the amenorrhea. Lifestyle disorders. Sometimes lifestyle disorders contribute amenorrhea. For instance, low body weight. If the girl is very low body weight, 10% than normal body weight, this interrupts the hormonal function of the body, potentially halting the ovulation. When the person is normal and healthy, ovulation happens on frequent intervals. But if the patient is below 10% of the normal suggested weight, then the hormonal secretions get affected and ovulations will not happen. Women who are eating disorders such as anorexia or bulimia often stop having periods because of the abnormal hormonal changes. So that's what Murthy said. If you are constantly on junk food also, or if you are having the appetites will go down and your hormonal imbalance will be there, and that can also cause amenorrhea. So we should have enough eating regularly, and they should have a choice of food, eating everything what is required. Professional advice should be sought if there is a problem, and all exercise and everything in the gentle movements. De-stressing can help. Support from friends and loved ones will be helping. Then bone health after exposing to sun. These are the pictorial expression for healing hypothalamic amenorrhea. So amenorrhea, the excessive exercise. If the woman is participating in activities that requires rigorous training, such as ballet or strenuous sports, may find their menstrual cycles interrupted. If they are working out too much, their exercise is too much, then that also can affect the periods. Several factors combine to contribute to the loss of periods in athletes, including low body weight, body fat, stress, and high energy expenditure. So if they spend too much energy, they have less fat. Fat is required for hormone production. So if they don't have fat at all, then hormones only secrete, and the menstruation will not happen. Then stress is there. Mental stress can temporarily alter the function of the hypothalamus, an area in the brain that controls the hormones and regulates the menstrual cycle. Ovulation and menstruation may stop as a result. Regular menstrual period usually resume after the stresses decrease. So when the patient is normal, after stresses come down, then their cycles become normal. So hormonal imbalance is another cause. Many types of medical problems can cause hormonal imbalance, including polycystic ovary syndrome, PCOS. PCOS, the polycystic ovary syndrome, causes relatively high and sustained levels of hormones rather than fluctuating levels seen in menstrual cycle. So in menstrual cycle, the hormones go up and then come down, go up and come down. But in go up and come down means each hormone levels will be high, and when the periods started flowing, it will come down, and slowly it will increase, and then it will come down. So monthly there is an up and down fluctuation in normal ladies. But when you have PCOS or the polycystic ovary, the residue of the eggs, what has been discharged and not released into the system, will be producing hormones, something like male hormones, and that will be in a constant level. So that also is the cause of maintaining amenorrhea because of hormonal imbalance. So then the other cause is thyroid malfunction. If an overactive thyroid gland, that is hypothyroidism, or an underactive thyroid, which is called hypothyroidism, can cause menstrual irregularities, including amenorrhea. So because of the overactive or underactive thyroid gland, there will be menstrual disorder. Then some tumors, the pituitary tumors, a non-cancerous, that is a benign tumor in the pituitary gland, can interfere with the hormonal regulation of menstruation, because that will be not secreting the hormones properly, and that even though the tumor is benign, that can cause irregular menses or no menses at all. So then premature menopause. Menopause usually begins at the age of 50 or 45, 50. But in some women, ovarian supplies of the egg diminishes before age of 40. That means when the girl is born, there is a set the regulated amount of egg supplied to her, and that is to be used up in her lifetime. But some reasons or some genetic reasons, the stock will not be good enough to reach up to 40, 45. So the supply diminishes off at the age of 40, and then they have become they attain menopause early. So that also will stop menstruation. Then structural problems. Problems with sexual organs themselves can also cause amenorrhea. For example, uterine scarring. Uterine scarring is a scar inside the uterus. Some injury and healing will cause scar. Uterine scarring or Asherman syndrome is a condition in which scar tissue builds up in the lining of the uterus and can sometimes occur after dilation and curettage. DNC, when for some reason the doctors do a DNC, that they clean up the internal part of the uterus, and the scar tissue develops, and after that there may not be menses at all. The cesarean section or treatment of uterine fibroids also can cause scar tissue. Uterine scarring prevents normal build-up and shedding of uterine lining, and that means the menses will not happen at all. So next is lack of reproductive organs. Sometimes problems may arise due to fetal development that lead a girl to being born without some major part of her body, of her reproductive system, such as uterus, cervix or vagina. If the girl is born without a uterus or cervix or vagina, then also she may not be able to menstruate at all, because her reproductive system did not develop normally. She cannot have menstrual cycle. Structural abnormality of vagina. An obstruction of the vagina may prevent the visible menstrual bleeding. A membrane, everybody knows there's a membrane called hymen, and it has porosity where in normal people the menstrual blood flows out, but in certain cases the vaginal opening is blocked by the membrane, and the flow of the blood may not be seen outside from the vagina. So that is another condition, structural abnormality. So signs and symptoms. The main sign of amenorrhea is the absence of menstrual period. Depending on the cause of amenorrhea, the women may experience other symptoms along with the absence of period, such as hair loss, headache, vision changes, excess facial hair, pelvic pain, acne, vaginal dryness, and night sweatings. So these are the symptoms along with the amenorrhea, which is even though the periods are not flowing, these sort of symptoms also may be shown. Now the diagnostic evaluation, how to analyze that. History collection, physical examination, blood tests may be performed to develop determine the levels of hormones secreted by the pituitary gland. That is, pituitary gland secretes FSH, a follicular stimulating hormone. Then luteinizing hormone is LH. TSH is thyroid stimulating hormone, and prolactin. So these are all required to propel the normal sexual cycle of a lady and to have menses or ovulation, and in ovaries estrogen is also secreted. So these are all required. If the blood test reveals the inaccuracy or inadequacy of these hormones, then that will be the cause of that. Test results will be useful to treat them. Ultrasonography of the pelvis may be performed to assess the abnormality of the genital tract, or to look for polycystic ovaries. If there is the ultrasound scan done, ultrasonic scan done on the abdominal area, we will know whether it's a polycystic ovary or any other blockage in the tract is there. Then CT scan or MRI of the head may be performed to exclude pituitary or hypothalamic causes for amenorrhea. If the amenorrhea is there and the other causes are not there, an MRI scan or CT scan of the brain or will reveal if the hypothalamus and pituitary areas are good. So if the tests all these tests are inconclusive, and tests may be performed, including thyroid function test can be done after that. Determination of prolactin levels by blood test again. Hysterosalpingogram It's an X-ray of the uterus to examine the condition of the uterus, and hysteroscopy is again a scope being put into the uterus and study the condition of that. So allopathic management, we have to see management systems. Allopathic management includes hormone replacement therapy, use of dopamine agonist, that is a hormone treatment again, administering metformin, the diabetic pill, no, metformin, that is diabetes or something like that. Medicine is that for metformin, oral contraceptives, invasive surgical treatments to remove pituitary or hypothalamic tumors, or to remove intrauterine adhesions. These are the allopathic methods of management. So we in homeopathy have homeopathic medicines. Women having amenorrhea can be treated with homeopathic medicines by treating its root cause. This can regularize the cycle and can manage the pelvic pain, milky discharge from the nipples without pregnancy or childbirth, milky discharge from the nipples, hair fall, facial hair, acne, or that's pimples, and headache, which sometimes accompanies missed periods. So these are the things which we can address with our homeopathic medicines. So now Pulsatilla, everybody knows, is the top grade homeopathic medicine for missed periods and amenorrhea. The women have the tendency to get periods late, always late, and scanty menstrual flow, black, clotted or thin and watery bleeding will be there. Other symptoms include headache, painful periods, periods with pain, chillness, nausea, vomiting, with milky discharge from the nipples, acne from menstrual irregularities, hormonal imbalance, etc. These are the indicated symptoms of pulsatilla when there is this amenorrhea and menstrual period disorders. So Sepia is another leading medicine for absent menses or amenorrhea. Sepia corrects the hormonal imbalance, delayed periods for many months, scanty flow, violent abdominal pain, bearing down pains before periods, pimples before periods, excessive facial hair is also indicated in Sepia. For Sepia, Natramor for amenorrhea and hair loss, indicated for suppressed menses from grief also. Delayed appearance of and profuse when shown up. So the delayed menses, and when it shows up, it will be profuse. Menstrual flow will be thin and watery and pale. Headache can appear before and after menses. Prominent hair loss is present. So that is Natmar. Phosphorus, Murthy sir has already given and proved the action of phosphorus in amenorrhea. And amenorrhea with milky discharge from nipples is the indicated symptom of prime indicated symptom of phosphorus. Periods very late but very profuse and may last for too long. Bright red menstrual blood, pain in the ovaries, and also having severe backache. So he was telling abdominal pain and no menses shown up. So that is the reason the ovaries are paining, and tired and weak after period. So after period she is weak. So again the phosphorus is the same medicine. Smarting and burning vaginal discharge will be there after period. So phosphorus has so many symptoms. So Senecio auris is a new medicine. The amenorrhea is for in young girls. That is the small girls who feel like they are getting the menses, but nothing will happen. So such girls, this medicine works well. They usually have back pain or pain in the shoulders along with suppressed periods. So periods will not show, and they'll have shoulder and back pain and along with this amenorrhea. Graphitis, he also mentioned graphitis for females having tendency for late and scanty menses. Late and scanty flow, violent pain, menstrual blood will be thick and dark, sometimes blackish. Gushing vaginal discharges may be present after the periods. So there will be vaginal discharge. Like also, heaviness in the arms and legs may be felt. And conium for amenorrhea with tendency of late and short periods. Periods are scanty with clotted blood, pain and swelling in the breast. Small red pimples appear on the body during periods. After periods, she will have itching in her vagina. Olean jack, this is another important medicine for amenorrhea and facial hair. many ladies suffer of facial hair, and this Odium Jack works very well for treating excessive facial hair in women. Soreness in the ovaries and painful periods are other indicated symptoms. Ignitia for suppressed menses due to grief. Ignitia is indicated for suppressed menses for women who feel sad, depressed, and frequently weeping spells. So that for suppressed suppressed menses due to grief. Then this Jonesia ashoka is for suppressed and scanty menses. Amenorrhea and scanty irregular periods are indicated symptoms. Headache, pain in the lower abdomen, pain in the back and thighs are other indicated symptoms. So further menstrual disorders are there like menorrhagia, metrorrhagia, and dysmenorrhea and premenstrual syndromes. I will be addressing one by one in the coming classes. That's all now. Thank you. Thank you, sir. Thank you, sir. Suresh, sir, if you are there, please continue, Suresh, sir. Thank you.
Excellent presentation, Anup. Great presentation.
Thank you, sir. Suresh, sir.
Okay. Is audible?
Yes, sir. Yes, sir. Yes, sir.
Okay. A warm good evening to all the group members. We are talking and discussing in the last class about the posology, the doctrine of dosage, in which some introductory aspect of it, this chapter, like what is a maximum dose, what is the physiological dose, then fractional dose, and infinitesimal dose. Like this we defined and we gave a pause that. Today we'll see the logic and advantages of the diluting, plusing, and dividing the dose. There is a new term here, plusing. The advantage of diluting and plusing and dividing the dose. This is very important. What is plusing? Let's understand this. Plusing is a method which consists of dissolving globules of the remedy in 11 teaspoons of water. I will go very slowly. Is a method of dissolving globules of the remedy in 11 teaspoons of water, and the patient takes or sips 1 teaspoon of each dose. The patient takes the sips or takes 1 teaspoon of each dose. This is the introductory, and then between each dose the water is very shaken thoroughly. The water is given deep shake, and the patient takes one by one the divided dosage 10 teaspoons and reserves the last teaspoon for the next day. The 10 tablespoons of water is added and globule is added. It is shaken, divided into 11 parts. 10 divided parts, 10 teaspoons are dissolved remedy in water is taken, and he leaves the 1 teaspoons for the next day. Again, on the next day, the 10 teaspoons of water, fresh water, is added to the original mixture, that is the 11th part. No fresh medicine is added, no globules are added, and it is well shaken, and the same process is repeated. And this way, taking a 10 divided dosage on a one particular day and leaving the last 11 teaspoon for the next day, that is being continued for 7 consecutive days. This procedure is continued for 7 consecutive days, and after which the remedy is changed, or a fresh remedy is dissolved and taken as a fresh dose. So this procedure is known as plusing. So this has been advocated in our organon, as well as our masters are also advocated it. So this is the dividing dosage into 10 equal parts and taking as a 10 dosage on a particular dose, and the 11th dose is taken as a standby for the next day, and that is again added with 11 teaspoons of water, and then it is well shaken, and 10 spoons are next day, it is 10 spoons are again taken as a divide dose. Again 11th part is being reserved for the third day. Like this, it goes for the 7 days and we complete the cycle. So this is known as plusing. So this is known as plusing and dividing the dosage. So why this is there? What is the logic behind this plusing? First, the first important aspect of this is gently it stimulates the vital force and smoothly overpowers the artificial disease. I repeat, our masters are suggested that it gently, very gently, it stimulates the vital force. It did not give the jerk. It did not give the shock to the vital force. It gently stimulates the vital force and smoothly overpowers the artificial disease also. Whenever there is a conflict between the two forces, between the artificial disease force as well as the medicinal force, this conflict should not be very violent. So that's why in order to prevent the violency in this organism, that's why this plusing method is being given by our masters. So in order to have a gentle stimulation of the vital force and smooth overpowering of the artificial disease, this is one of the logic or reasoning behind the diluting the dosage. So diluted and divided doses are extremely useful in fighting the disease, and coolly and calmly, that is, no violency is being produced in the organism. This is one of the reason why we have a divide dosage and plusing method is being adopted. This again, the second reason for this is to avoid unwanted aggravations in very sensitive patients. There are very sensitive patients we come across. So in them, there may be possibility of aggravation. So in order to prevent or in order to overcome this unwanted aggravation in the sensitive person, diminution of the strong power of the medicine is advocated. So this has been quoted in section 285 of the article 285 of the 5th edition of our organ. So another reason for this is to avoid the unwanted aggravation in an extremely sensitive patient or other idiosyncratic patients also we can say. Then third, the reasoning for this is the best result, succession and phased dose through modification every phased dose, which is given in several different forms, can best extract the morbid disorder. So the morbid disorders which is there, that is also weaned away with this process. So with each succussion and each flushing, so the morbid aspect of the content of the dosage also been reduced infinitely small. So this is also one of the important reasoning behind this. Then another reason, unchanged and unmodified dose produce aggravation. This is also another finding by the master that the unchanged and unmodified dose produces aggravation. So about this unchanged dose, it is quoted in section 246 of the 6th edition. Then the another reason, 6th reasoning given behind this is divisibility of the dose is not addition of the dose, but gradual and proportionately liberation of energy. What is important that at one end, by the process of succussion, the process of the plusing method, we are morbid content is being reduced, or the crude content of the dose or the material substance is reduced. At the same time, the energy liberation is also enhanced. So that is, with each gradual increase in proportionate succussions and plastic method, the liberation of energy is enormous. So this is also one of the reasons that it's been divided doses has been also advised by the masters. So this is quoted in 287, section 287 of the fifth organ of our organ of medicine textbook. So these are the reasons. These are the 5 important reasons in order to stimulate the vital energy. Further, in order to overpower the artificial disease very smoothly, to prevent the unwarranted aggravations, and in order to have a divided dosage, so that with each divided dosage, the aggravation is also prevented. At the same time, the morbid content of the crude drug is being reduced, as well as the energy liberation is also enhanced with the successive potentization or successive plusing method. So these are the advantages or the logics between the plusing and dividing the dose. So this is about the division of the dose and plusing method. Coming to next, stalwart views on posology. About the posology, various stalwarts have given some important views. Let's also see that also under this chapter. Let's see the first Boninghasen, the great master, followed the Hahnemann. He's Boninghasen, a contemporary of the Dr. Hahnemann, was clearly in favor of the high potency. Boninghasen was in favor of the high potency. He wrote many papers in support of the high potency and listed thereby many advantages. He has also listed many advantages this using the high potency. So first is he says the first important as the sphere of the action, the sphere of the action continuously enlarges with the high potency. In case of a chronic ailments, they hasten the cure. So he advocates the usage of high potencies in chronic ailments because that hastens the cure. That is one of his opinion of the Dr. Hahnemann, Dr. Boninghasen. In second point, Boninghasen says in acute diseases, the effect is very quicker also. In acute diseases, the effect of the high potency is very short and quick. And the third, he says that in spite of the discretions in the diet and regimen, high potency is very efficacious. In spite of the discretion in diets, the high potency do not have much impact on account of the diet changes. So these are some of the advantages which has been highlighted by Dr. Boninghasen, and he advocated the use of the high potency. Then next, father of homeopathy, Boger. Boger, he has also used both low and high potencies in his practices during his time, but he seems to have utilized all potencies equally, and he was very partial towards the high potencies. Boger was not in very high favor of high potencies, though he used in his time, but he used low potencies and medium potencies more. So he was very partial towards this use of high potency. Then coming to the next master, Clark. Clark, a famous, he has given his book, Dictionary of Materia Medica. He says that in ordinary practice, with acute illness, the lower dilutions will be more useful. In acute, Clark has opinion that in case of acute illnesses, the lower dilutions, lower powers are more useful, and for the chronic diseases, higher dilutions are more required. So this is the opinion of the Dr. Clark about the low potency and high potency. Then coming to the Master Kent, who has given the repertory, who has given the Materia Medica also, which we are using till date. The Kent was not only an exponent of the medium, but also he was using high potencies, and he was also the preceptor of the generation of high potencies. So he largely advocated the use of the high potencies. It was because of him, because of the Kent, the students, that high potencies come into vogue in England and Western countries. Because of him, the students in England as well as in Western countries, they started using frequently the higher potencies. Kent is still considered the person who has influenced the use of high potencies the most among the homeopathic community. He has been largely he has used high potencies very widely in his practice among the all masters. He further writes that when the similimum is found, the remedy will act curatively in a series of potencies. If the remedy is only partially similar or it is not similimum, it will act in one or two potencies, and then symptoms will change and new remedy will be required. So this is the Kent's opinion. So he says, when the similimum is there, when you are sure that the remedy is similimum, why you are afraid of higher potencies? Go in higher potencies. That is the opinion of the Dr. Kent. But when say that at the same time, if the similimum is not there, you are hesitant, physician is not sure about the similimum, be in a lower level of potency. This is also the advice given by Dr. Kent. Then another master, Robert. Dr. Robert, great master, has also given many books. So he advises the symptoms. He says, when symptoms are very similar, we can go high in potency if we wish, and less sure we are about our similarity, be in lower potency. Again, same version like Kent. Dr. Robert says that when you are sure that where similimum is there, high similimum is matched, then definitely you you can go in higher potency. And when you are not sure about the similimum, be in the lower potencies. And as a rule, he also suggests that when there is a pathology, Dr. Robert says that when there is a pathology, medium or high potencies may be dangerous. So he also given a caution, he also given warning in his advice that whenever the pathology is existing, don't go high. Use medium potencies or low potencies preferably. This is about Dr. Robert. Then Dr. John Wyer, he is also great homeopath. So Dr. John Wyer, he has given many books. He has nearly 35 years of clinical experiences. He says that low potency should be used for physical illness, external conditions, and skin conditions. Dr. John Wyer advocates that please use the low potencies in case of physical illnesses, wherever the external conditions are being perceived, or whenever the skin diseases are seen. In those situations, you use the low potencies. Whereas whenever the mental symptoms are very strong, whenever the mental symptoms are found very evident and strong, then you are allowed to go in higher potencies. So Dr. John Wyer has advocated use of low potencies in case of physical illness as well as skin ailments. Whereas whenever the mental diseases or mental symptoms are predominant and high in degree, in intensity, then he advocates the use of high potency. Then the another man, great man, Nash. Nash he has always strongly favored medium and high potencies. So during his career, Dr. Nash, he has used medium and high potencies more. So coming to last, George Vithoulkas is a contemporary. So George Vithoulkas lays the following guidelines for the practitioners. He says that the science of homeopathy, patients who have a weak constitution, old people, geriatric patients, senior citizens like that, old people, and very hypersensitive people use decimal potencies like 6x, 12x, like that, 3x, etc. And from there, he advocates up to 200 potency. So here, George Vithoulkas says that please, for the weak constitution, for old people, geriatric patients, and very hypersensitive people, use the decimal potencies or low potencies of centesimal scale up to 200. Then he says, oversensitive patients are very reactive to both low and high potencies. So oversensitive people, he gives a choice that either you can use low potencies or the higher potencies because they are highly reactive to both. So for them, we can either have a choice of using low as well as the high both. Then he says for children who are suffering from severe problems should be given low potencies only. Children who are suffering from very severe critical problems, complex issues, then they should be always given low potencies. But cases with known malignancy, you should not go higher and above the 200. He says, wherever the case is known for malignancy, the physician should not go beyond 200. So medicines having a strong tendency towards pathology, the restrictive lower potencies 30 to 200 is to be used unless until the individual case demonstrated by free of pathological conditions, physical pathological conditions. So Dr. Vithoulkas, he advocates that wherever the pathology is existing, please use lower potency, don't go beyond 200. Limit yourself between medium potency up to 200 only. So this is the way how the George Vithoulkas has given advice to us how to use the potency in case of weak constitution, in case of old people, senior citizens or geriatric patients, for the children and oversensitive people. And in case of, he also says, one advice that in case of children's, in acute ailments, you can give best potencies lower than 200. So this is also been advocated by George Vithoulkas. So this is all about the masters who have different opinions and different guidelines they have given about the usage of lower potencies and usage of higher potencies depending upon their clinical experiences and their practicing confirmations and various provings. So I have given widely the opinions of Bonninghausen, Ken, Boger, Clark, Roberts, Dr. John Weir, and up to till contemporary George Vithoulkas. Up to this, all the masters have given their opinion. So to in summarize, I have given the opinion of all the people usage of how to use the lower potencies, how to use the higher potency, what are the conditions we should be careful, or rather we should be more prepared in different situation how to use our weapon. That is medicine, let's not take as a simple thing. Let us take the medicine or the remedy which we are advocating is a weapon. So when we are using weapon, we have to use it as a careful way, and potency selection should be our utmost consideration. So these are the various opinions I have summarized here about the usage of dosage, high potency and low potency. So with this, we'll give a pause to this, and further next class we'll again further travel how to use again the low potency, in what are the situations we have to use higher potency, what are the situations we have to. We'll go ahead with more and more elaborate way. We
Sir,
will
I have
go-
one question, sir.
Yeah.
So, which 200 is a lower potency or higher potency, sir? 200.
As per the masters, they classify 200 as a medium potency.
Medium.
Okay. As a masters, when you look into up to 200 days, they designate as a medium potency. But from our practicing point of view, in our MPHA, we consider 200 as a higher potency only. Okay, please, I'm just giving my advice to all people. We consider 200 and above all as a higher potency. But 200 below we can consider as a medium. But the masters have, all masters have said that up to 200 the scale is termed as medium. Okay, over to Dr. Anup Murthy.
Sir, Gobind Bharani sir.
Thank you, sir. It was very good.
Gobind Bharani sir. Next week you ask about the potency, I will tell. For practical purpose, what type
Okay.
of potency we can use, tell you.
Okay.
So today's time is over. We will meet next week. Thank you very much.
Thank you very much. Thank you all.
Thank you.
Thank you all.